my name is Jennifer Majori, and I'm founder and CEO of Red Balloon Social Media, a results-driven social media agency serving clients nationally for more than a decade. In addition to social media management and corporate training, specifically, we specialize in training healthcare professionals to avoid HIPAA violations in their personal use of social media. The Institute for Health in a recent survey found that only 1/3 of healthcare organizations have documented social media guidelines, which is a huge problem compared to the fact that so many adults are using social media. 3/4 of adult internet users alone have a Facebook account, including your doctors and your nurses and your administrative staff. So it's really important to make sure you've got those guidelines in place. In addition, you want to make sure that those guidelines are getting reviewed on a regular basis. Social media changes quickly and it can change daily. Your guidelines have to be able to keep up with how people are using social media and new platforms. For example, when live streaming started, it added a new dimension to that training. In addition to having documented guidelines, it's important to offer that training in a really interactive atmosphere. So if possible, training in person is really terrific. Obviously, during new hire orientation and offering refreshers, it really helps that information to stick and for them to retain it. A few more quick tips for topics that you would want to cover. One, we always recommend never, ever, ever post anonymously. There is no such thing as anonymity online. It's actually really easy to find out who you are. If you can't stand by it, don't post it. Something about posting anonymously just emboldens us to say and do things we normally wouldn't, so just don't do it. Another thing we always advise against is talking about any individual patient. HIPAA guidelines cannot possibly define every piece of protected health information that could be used to identify a patient. So your best bet is to just stay away from posting about any individual patient so that you'll be in the clear. Last but not least, make sure that you address using mobile devices in patient areas and valid consent. So not using your mobile phone to take pictures or to text or to take videos around your patients, and never ever think that an innocent selfie with a patient is acceptable. Verbal consent is not valid consent. The only form of valid consent for developing media with patients would be written consent in an agreement with administration. So no selfies. That might be a totally normal, fun part of day-to-day life for most people, but not for healthcare professionals. If you have questions about helping your healthcare staff avoid HIPAA and NLRA violations in social media, check us out at redballoonsocialmedia.com or watch another video.